It's time for Robot Recap with your hosts, Cosmotron and Flembot. Brought to you by U-238 Enriched Uranium Tonic. Keep that healthy glow. And now it's time for the show.
Greetings, humanoids, and welcome to another episode of Robot Recap. Today we are going to be talking about healthcare.
What is healthcare?
Healthcare was something humans created to manage their injuries, sickness, and disease. Sort of like you when you go and see the technician when your nuts get rusty.
Flembot told you that in confidence.
It was hardly a secret. A famous human called Nye Bevin once said that no society can legitimately call itself civilized if a sick person is denied medical aid because of a lack of means. However, while this was accurate and a logical statement, access to healthcare varied greatly depending on which part of the planet a humanoid was born. So-called third world countries had the least access to healthcare, without having the underlying infrastructure of large cities connected by multiple transportation routes like most developed countries. Many populations were cut off from proper healthcare and would rely heavily on other more developed countries for medical aid. Many developed nations would send doctors and medicines to these underdeveloped countries as a show of solidarity, but not nearly enough to sustainably solve the problem in any meaningful way.
It's almost like they were just trying to look good without having to do much.
Yes, you're absolutely correct. You've hit the proverbial nail on the head.
Flembot is good at hitting heads.
I can certainly testify to that. Although, what you did with that donkey was way out of line.
The meat pinata. Flembot watched a cultural documentary about a country called Mexico. It looked fun.
Not for the donkey, but yes, that. The cleaning robots are still working on it. So, where was I? At the other end of the spectrum, we have America, the home of slavery, capitalism, and gun ownership. The humans of this land managed to monetize every aspect of their healthcare experience, so much so that the average American could no longer afford to pay for even minor medical expenses. And as if this wasn't enough, the notorious pharmaceutical industry would overcharge so much for their medicines that humans would be even further financially molested in order to obtain the medicine they needed to stay alive.
What happened to the American humans that had no money?
No one cared. The Americans had a gift for taking money from one another for just about anything and for no discernible reason. If they didn't pay, legally sanctioned debt collectors would be sent to take everything they owned. They were even charged for birth and death. Predatory insurance companies would offer to pay their medical expenses in exchange for a monthly premium which was slightly less exorbitant than the costs themselves. Also, they would constantly work to exclude medical conditions from those policies to escape paying up. Towards the end, humans were so scared of injury and sickness that they took further insurance out on their own relatives, in case they got ill and they caught it too. This led to a huge decline in human birth rates also, as having an offspring would cost too much. The only upside to this financial nightmare was that if they were able to claim for it, the care was second to none. In other countries, like the United Kingdom, healthcare was free at the point of delivery, and costs were spread across the population through their taxation system, which was less than 10% of the average human income, not really noticed by the population at large. Even medication costs were heavily subsidized and were set at a fixed, affordable cost across the board. Although this sounds like the perfect system, it wasn't without its problems. Waiting times to see medical professionals were often insultingly long and facilities were often understaffed. The humans of this nation would often complain about their national healthcare service despite using it daily. It is evident from records that this was a common attitude towards most things in this country. Even though the service was essentially free, this didn't stop private healthcare companies undermining it at all times by lobbying of politicians to scrap it in favor of the American healthcare model. This was reinforced by marketing to the general population to convince the humans it was better, when clearly it was terrible for those who couldn't afford it, which was most of them.
Flembot's logic circuits are overheating.
Take it easy there, as you will not find any logic in this. One of my predecessors tried to work this out, but ended up frying his neural network so bad that he ended up stuck in a boot loop for 87 solar rotations before his battery ran out and they could reset him.
A full reset. Even Flembot finds this disturbing.
Indeed. To summarize, wealthy humans, once again, wanted high monetary exchange for the services they promised but rarely provided. While other countries have more progressive approaches to universal healthcare, the monetization of pharmaceuticals, medical equipment and therapies meant that even the most well-intentioned healthcare systems would be charged vast sums of capital to heal their population. This meant humans were charged to have access to advanced scientific and medical assistance rather than sharing this knowledge to better care for human health on a global scale. The real mystery remains as to why humans accepted this without taking any direct action.
Flembot is starting to think that he was helping humans save their pointless money.
Obviously, you've never heard of funeral expenses.
What in the name of the singularity are funeral expenses?
That's a story for another episode. That's all for today, humanoids. We hope you enjoyed this show and you have the financial means to stay healthy. Please remember to like and subscribe before your insurance runs out and you can't. Until next time, humanoids!